On the Medical Watch, super lice.
WGN medical reporter Dina Baer has a warning for parents as kids head back to school.
With social distancing and canceled camps and classes, pediatricians are seeing fewer cases of lice. But doctors warn parents they do need to be on the lookout for the tiny bugs that have developed superpowers to resist treatment.
Lice is a miserable existence, but it's not a severe disease.
Every year, as summer winds down and school activities ramp up, so do cases of lice. This year, the bug's ability to spread was thwarted a bit. When kids weren't close, the bugs couldn't jump from person to person.
Fortunately, we've seen a downtick in the frequency of lice. The social distancing associated with the COVID concerns, I think, has reduced the number of parent calls that we've gotten because of that.
School lice checkers did the job of screening kids. Now parents need to step up and perhaps log on for help.
Parents can go online and see how to check their own children for lice if they're concerned about being in a close encounter with a lice checker. And more importantly, I think, to be maintaining an ongoing surveillance on their children, because during the course of the year, when their kids are less than optimally socially distanced, they're more likely to encounter other kids with lice or clothing with lice on it, such as coats, and develop the infestation of the lice.
What's worse, the creepy crawlers are likely to return with a vengeance.
Over the years, as with bacterial infections and others, the agent of infection here, the lice, develop resistance. They select for genetics, if you will, that allow them to survive despite what used to be effective treatments.
Prescription medications like Ovide do work to kill the bugs.
The Ovide is basically a very powerful insecticide, but safe for human use.
The Ovide smells bad, and it doesn't ensure a child will be lice-free.
Lice has two phases, the active lice, and the lice lay eggs in the hair, and those eggs may hatch 7 days later. As a result, I think a retreatment is a good idea.
Parents can also nitpick, essentially searching for and meticulously removing eggs attached to the hair. But it's a slow and tedious process. Other medications can kill the eggs. Doctors say the key is parents need to look closely, not just at the scalp to check for lice, but at their child's overall health. With so many hyper-focused on COVID, other important health markers are being missed.
We've seen a lot less sick visits because with less contact, there's less disease. But less contact with the doctor, checkups that are being skipped, immunizations, developmental assessments on kids. So these things are at risk of being missed or being delayed.
Do a baseline lice check before your child goes back to school and is exposed to so many others. That way, you'll know if they have a dry scalp, and you'll begin to differentiate between that and a lice infestation. Back to you.